Honourable colleagues, I rise today as the Senate sponsor of Bill C-284, an act to establish a national strategy for eye care and to designate an age-related macular degeneration awareness month, AMD. I'd like to acknowledge the tireless efforts of MP Judy Scrow, who has championed a national strategy for eye care in the other place and raised awareness around AMD and other vision health issues. The bill's unanimous passage reflects a shared recognition of vision care's importance in our society. I wish to begin by expressing my sincere gratitude to the Standing Senate Committee on Social Affairs, Science and Technology for their dedicated study and review of this bill. Over 4 insightful meetings, the committee heard from key stakeholders, including the Canadian Council of the Blind, Vision Loss Rehabilitation Canada, Indigenous Children Eye Examination, and Health Canada. Their careful work underscores the Senate's commitment to improving healthcare outcomes for all Canadians. The bill was reported back to our chamber without amendment. I'd like to thank Senators Cormier and Magee for their observations, including that Health Canada should effectively consult official language minority communities if this bill is duly passed, and that the national strategy explicitly consider regular eye care follow-ups as part of its prevention methods. Recognizing that regular eye care follow-ups are not always systemically practiced. Collectively, the committee supported the need to reduce preventable blindness and improve eye health for Canadians through a coordinated approach. One of the most celebrated aspects of Bill C-284 is its broad and inclusive design. It creates an opportunity to include everyone impacted by vision loss. This framework, which is intentionally not prescriptive, allows its potential to evolve and encompass a wide range of voices and needs as it develops. The bill that is before us today is straightforward. It calls on the Minister of Health, in partnership with provincial governments, Indigenous communities, healthcare providers, researchers and other stakeholders to develop a national strategy for eye care. It is designed to address essential elements such as prevention, early detection, treatment and accessibility for all Canadians, including enhanced access for Indigenous communities. The strategy would also encourage the development of innovative therapies and aim to standardize eye care practices across Canada's healthcare system. Like other strategy or framework bills, it has a reporting requirement, in this case 18 months after the day on which the Act comes into force. Through the designation of February as AMD Awareness Month, this bill recognizes the unique challenges that are posed by AMD. This progressive condition affects millions of Canadians over the age of 55 and has widespread impacts on their independence, mental health, and quality of life. As our population ages, we must continue to increase awareness and ensure accessible treatments are available. Why February? Having Canada formally recognize February as AMD month aims to commit the nation to a focused effort in raising public awareness and understanding of this significant eye condition. The Canadian Ophthalmological Society, the CNIB Foundation, and non-profit organizations like Fighting Blindness Canada already lead educational campaigns during February that stress the importance of early detection, prevention strategies, and effective management of AMD. These campaigns include webinars, public workshops, vision screenings, outreach programs offering comprehensive print and digital resources. Pharmacies and local health authorities also play a key role by promoting eye health through informational displays and community events. Collectively, these initiatives emphasize regular eye exams and proactive measures to help Canadians safeguard their vision and navigate the challenges of AMD. Formally recognizing February as AMD month would reinforce these efforts highlighting the importance of education and support in promoting eye health and empowering individuals with the knowledge and resources they need. During committee discussions, it became evident that the gaps this bill seeks to address are critical. We need to increase access to eye care services in both urban and rural areas, making screenings and treatments affordable to all. We need comprehensive educational campaigns to highlight the importance of early eye checkups to prevent common conditions like cataracts and glaucoma. We must train more optometrists and vision health professionals and better integrate technology, including telemedicine and advanced diagnostic tools, to improve access, particularly in remote areas. Additionally, we must ensure that Indigenous communities can address their unique eye care needs. While Bill C-284 does not stipulate funding for these gaps, after all, it is a private member's bill, it is a starting point that can catalyze conversations about future investments. A national framework would bridge the inconsistencies in eye care across our provinces and territories and address the rising prevalence of vision-related health concerns across our country. It would also support culturally appropriate, inclusive services tailored to the need of our diverse communities. Jurisdiction often seems as divisive and complex was an important point of discussion that also brought valuable insights. How do we ensure federal coordination without stepping on provincial jurisdictions? Health Canada representatives assured us that this collaborative approach is well established. Previous strategies, whether for diabetes, palliative care, PTSD, or autism, show how the federal government can successfully play a unifying role, bringing stakeholders together, reducing duplication, and fostering solutions that benefit all. Canada has the opportunity to lead globally in delivering comprehensive eye care. The reality is that this bill addresses an issue that touches the lives of countless Canadians: access to vision care. Our ability to see allows us to experience the beauty of our world, connect with others, and navigate daily life. Yet for many Canadians, vision care remains out of reach, a luxury rather than an accessible component of our healthcare system. I have personally seen the impact of this gap during my years as a family physician, and I know that many of my colleagues have similar experiences. Whether directly or indirectly, vision impairment affects us all. Over 8 million Canadians have an eye disease, with 1.2 million expressing vision loss or blindness. Despite being largely preventable, 75% of vision loss cases remain undiagnosed and untreated due to gaps in accessibility and early detection. Vision care is a crucial element of our healthcare system, yet many Canadians face barriers, particularly those in rural or remote areas or those without private insurance. COVID-19, colleagues, has only amplified these challenges, causing missed appointments and delays in critical eye care. Honourable Senators, access to vision care and prioritising eye health is a matter of collective responsibility. This bill is long overdue and is one step in the right direction towards offering timely, essential supports to the millions of Canadians affected by vision loss. I strongly urge you, colleagues, to support this important piece of legislation without delay. Thank you. Merci. Miigwech.